Okay, now is a question time. Please put your hands up if you want to ask questions about the course. Are you still there? Anybody got questions? From most of your background, I can see you probably qualified or kind of meet our criteria for 2 years course with the foundation year, if without anatomy physiology. So do you have any questions? Rachel?
Yeah, I've got a few actually. I'm sorry. Is that okay?
No
I don't
problem.
want to,
Go ahead. Of course.
I don't want to
Any
take away
question?
from
We have
anyone
1
else.
hour. Yeah.
Okay. Oh gosh. All right. I was just there's a couple of things that I just wanted to ask. So I've been looking at some other courses as well in Leamington Spa in Yorkshire, and they're accredited differently. And I just wanted to know what the difference is.
That's a very good question. Actually, I'm invited to attend a meeting on the 8th of June, organized by British Acupuncture, BARB, the British Acupuncture Accreditation Board. So I'm organizing a session about acupuncture accreditation. So I have to say, in theory, in principle, we should be in the same standard. Of course, British Acupuncture Council, I would like to say the best quality normally is going into the, or the in-depth teaching, probably is going to like the degree equivalent teaching.
Okay.
So the difference is like British Acupuncture Council, I used to work for them as well as accreditation officer, accreditation committee. They accredited courses to the university acupuncture course, and now they become diploma or equivalent to university degree because they are still associated with the university. They're still validated by the university. So with the university validation, of course, you can see they are much more expensive. Did you see that?
Yeah, yes, I did. And I think for me, like I've got young children, so it would just be really inconvenient to kind of travel. So that was why I was, and I've got, like I said, I've got an acupuncturist at the moment, and I told him that I was interested, and he didn't know of the Manchester course, so he was saying, oh no, you better go into the Yorkshire one or Leamington Spa, and I didn't really know why. So yeah, I was just wanted to give...
They are more very academic focused.
Yeah, right.
So I was the external examiner for York. So I did raise that issue. It just depends what you want. If you want to be very pure academic, you become from York, you become a degree, the DXC degree. So then the modules involve in research methods, in each element of biomedical science, they have individual module like anatomy, physiology, pathology. I think Rachel also involved in teaching for York, and Annie also teaching for York. They also teach pathology at level 5 and level 6. So it's much more in depth. But for our course, we're more practical focused, more on the hands-on, and just make sure you have the knowledge to practice, to treat patients, and also safely with confidence. So we are not really academic route, is more practical vocational route. So I'm invited to attend that meeting. This question I want to raise as well as you, because the students get confused who I should go to Manchester, maybe whether the cheaper one is not good enough, or more expensive one is better, but you get unsure whether But the knowledge in TCM and also the knowledge in biomedical science, especially with your background, you probably already have some anatomy.
Yeah, I do. I've got a biology degree
So
and
what
nursing
else
degree.
you need? And
Nothing.
also we put the entry requirement as a first degree students. They already know how to do research.
Yeah.
And most people already have the professional kind of background. They don't have to learn the professional how to develop yourself because you already got the first degree. So that's why we said the post degree. Then what you need to be able to a good practitioner is to be safely used with your knowledge of Chinese medicine. Of course, medicine as well, you already had. So that's the difference. And especially we do 2 years postgraduate. It's based on like people like you have the background of healthcare professionals. I did approach BACC, but because of the tension between like the courses, if they accredited 2 years course, then making that 3 years course a big competitor. You understand what I mean?
Yeah, totally.
So they find it's not fair to do that. Of course, probably not. That's not the main reason. Maybe other reasons. So they are not accrediting 2 years course. The chair, Harriet, for the BACC accreditation committee was my colleague at Salford. They still wanted to accredit 2 years course. I don't think it got that agreement yet so far. So that's the difference. And also, we are a lot of hands-on and we are new. That's also make our prices much cheaper. It's half price to them. But our quality, I have to say, we are not any lower than others. When you graduate, you should be confident enough. Like, for example, we have 8 students enrolled to 2019. We only got 3 graduated. Still quite strict in terms of assessment. I still want people prepare enough yourself to go through this route. Not just it's not a requirement for academic writing, it's a requirement for safe practice. I think in that question, we don't also can answer you.
Yeah, no, that definitely answers my question, and it definitely convinces me that you know that it's a better route for me anyway. And another, I've got a couple more. Sorry.
Go on, no problem.
So my husband is an accountant, so I'm having to kind of put a business case to him for a career change. So I wanted to ask you if there is any support with kind of setting up a business sort of after you qualify, and if not, is it possible to work on site to gain clinic experience after qualifying?
Okay. That's a good question. While our final year's clinical practice, apart from you coming in to the clinic treating patients once a month, you also have the insurance from ATCM as a student's membership. That membership, you need to pay £30 for insurance cover to be able to treat patients with your own promises in your own practice. For people with distance, they also can treat like family members, friends, of course, with consent by the patients and not charging the patients. So you building up your portfolio to adding up all the hours and the practice. You need to show when we have the final assessment, show your portfolio that you have been treated patient independently, because unless you want to come in to our clinic to do 14 days continual practice, we still can help you to do that. But most people find it's very hard to commit themselves 14 weeks every week coming, because patients need weekly care. They can't just wait for a month for the next treatment. They want weekly, for example, pain relief. They can't wait for a month. But of course, with student clinic, we give the best kinds of deal, like £10 for the patient to be treated by students. So we have the teaching clinic built purposely for the student to help the patients. So in all this help is there. Are you in Manchester? Do you live in Manchester?
Yeah, I live in Stockport.
Okay, yeah. Our local, like Olga, who was talking, and Sophie, they're both in Manchester. They find it very handy. They come into my clinic every week, Friday, just observing and also as an assistant.
Amazing.
Then when you graduate, if you treat your patient yourself, your friends or your family members, they are still your patient when you graduate. Then you start charging them when you qualified. But during the student time, you're not able to charge them. And also you can only just bring them to the clinic. You can also bring the patient to our clinic. Our clinic have 5 cubicles, 3 rooms, separate rooms, and 2 cubicles. You can still treat them in our clinic.
Amazing.
If you want to use our clinic as your student practice site, it's fine.
That's great. And then what was the other questions I had? Oh yeah, so I'm obviously going to be on more suited to the 2-year diploma, but I was just wondering, because I did my biology degree sort of 15 years ago, so I was just wondering if it's possible to know the course content for the foundation year, just as kind of like a refresher. Is that possible for the students in the postgraduate course?
Yeah, I think Aaron, Dr. Yao has introduced the first foundation. Oh, you mean sorry. Foundation.
Yeah. So is it just
okay?
Is it possible?
Foundation year involving anatomy, physiology, and related pathology, because we realize you become a practitioner, a Chinese medicine practitioner. It is a medicine. You have to know medicine terms and some medical diseases. When the patient come into our clinic, you need to know the health, what means health, what means diseases. They bring all the notes from the doctor. You should be able to read.
Okay.
Of course, it's like we said, it's lifelong learning. I'm still learning some disease that I never heard about it. So I have to learn on the internet. This is the thing. Because most patients to us really is failed by the NHS treatment. So a lot of things is still very, very new and very, although I've been doing this for 35 years, I still need to learn. So you need to learn, but you will understand the anatomy, physiology. When people are normal, what it should be. When it's abnormal, what they become. So we also learn relevant physiology as well. So that's the first module. Before we designed for 5 weeks, 5 weekends. Each weekend is 12 hours. Now we become 7 weekends, just increase physiology part. Just make sure you know a bit of disease. Probably we'll introduce some drugs as well, just in case some drugs, for example, antidepressant, anti-anxiety drugs, or painkillers. At least you need to know some of the knowledge. So we have Annie will teach that. The second module is professional development. That's involving like the setting up your business. And of course, setting up businesses will be introduced during your practice. We will teach you or answer your questions about how to get your own practice going, setting up and like legal requirements or registrations, all this knowledge. And also the main thing is professional conduct for therapeutic relationships, like Rachel already introduced. She will be teaching that module. And some simple research methods. From our previous teaching, we find some students already had the background, but they forgot how to write the essay. Write the essay and referencing correctly, that's quite important when you graduate, become a kind of professional career. So that's something we'll be introducing in this module. And also in this module, we will introduce some professional research methods. Of course, if you in the future, if you want to involve in some research, you need to know what is qualitative, what is quantitative research.
Okay.
How to read the literature review, how to read the clinical research papers. That's quite important. Also, I said safe practice during this module. That will be 3 weekends, consist of 36 hours teaching. But of course, this course require lots of self-studying. I know you will be a new mom.
Yeah.
So it will be easy. So everyone will say it's not easy. I have to warn you, it's not very easy and simple. A lot of knowledge and coming into your your life.
Yeah. So that was kind of going into my next question. So like I said, I've got a young family and I have to continue with a part-time job. So what does a standard week look like for a student on the course? So you said that they do the 2 weekend, is it 1 weekend a month?
1 weekend a month, 10 weekend a year.
Yeah.
Yeah.
And
Apart from August, every month we have a weekend to teach.
okay. And so how many hours home study do you reckon?
It's double
The amount.
triple
Okay.
the clinical, the teaching hours. Depends on whether you can really concentrate.
Yeah.
And especially if you have a background knowledge, you spend less hours, but we really require you to do a lot of self-study. But if you just use our notes, our teachers are very, very conscientious. They prepare very well, very detailed notes. You can just use our notes to revise. And as long as you get all the notes, understand all the teachings notes, you should be able to pass your exam, basically.
Yeah. And this is my last one, I promise. So I'm dyslexic. So I noticed on the form you asked for to divulge if you were dyslexia. So in the past, when I've been at uni, I've had support and stuff. So what support is available while studying?
Usually just during exam, you have 15 minutes at extension. And for your assessment, also will have some help, that like assignment, essays.
Perfect. That's great. Thank you very much. Sorry for all the 20 questions.
Welcome. Good. I think Karen also asked a few questions. Oh, Karen, can you? Oh, microsystem. Yes, like auricular acupuncture and abdominal acupuncture will be covered, but not many. Many of them are more CPD courses, microsystem. But of course, auricular acupuncture is 100% in our curriculum. Abdominal, introduction to abdominal acupuncture, also in our curriculum. Is that what you meant? There are so many microsystems, and the face got microsystem, even the hands got microsystem. So that's become a bit, I think within this 2 years or 3 years, if you can learn, you can use our big system instead of microsystem to treat the patient. That will be good enough to be a good practitioner. If you want to develop further, when you become an ATCM member, you have plenty chance, opportunities to go for the CPD. This is also one of my jobs as a chair of the ATCM. I want to design some basic methods, acupuncture methods, to introduce to our new members or new graduate to learn. For example, we have the wrist, ankle kinds of acupuncture, just needle the wrist, six regions that treat the whole body. And we use the abdominal acupuncture. We have the FSN, which is what Ya Xiong is doing at the moment, and our Jidong Wu is our chair for the FSN's practice. So plenty. Did I answer your question? Karen, are you still there? Oh, okay. Gordon, do you enroll international students? We do have international students, yes. But that's just require English language level. Okay, any more questions? Karen, are you still there? Have you everyone just typing? Yeah, I think Dr. Yao already answered you. Auricular and scalp acupuncture, yes. Any more questions now? 赵淼有没有问题?
Hi, I'm typing the question here. Hi.
You can ask. You don't have to type. Just talk.
Oh yeah. Okay. Hi,
Don't
Dr.
be afraid, because in the future, if you become our students, just free to talk. Don't worry about talking.
I just wonder, will you accept me as a student who doesn't have any relevant background before? Do you think I can apply this course?
Yes, of course, we have foundation year. That's just designed for people like you. So just only thing is you have to do 3 years. But you still, because you got the high qualification, you got master degree, did you? From what I know. So you don't have to do 3 years, but you have to learn the foundation year.
Yeah. Yes. And when do we apply? We need to apply the course.
Yeah, you just download our application form online. You can just click apply, then you can download the application form online and send it back to us. So we will hopefully, while we are waiting for your references, then we will send you an offer letter, confirm offer letter by the latest by July. Then by August or probably early September, we know how many applications. If we don't reach our minimum number, we will have to say sorry. We are not running this year. So I'm a bit disappointed today because there are about 20 people registered for today's open day. Probably more than 20 after the later on adding up. I knew 18 last week, then the week before, then after 1 week, I think I saw a couple of emails registered, but it's only less than 10 present here. So I don't know why probably people have issues.
All right. Okay. Don't have more questions. Thank you.
No more questions. So basically, yeah, like Dr. Yao already said, if you have more questions, please email us. Our channel is still open, not just for the open day. So please do feel free to ask before you make your mind up. Should we wait for another 5 minutes for the question? Then we can finish our open day.
Hi, Megan and Dana, do you have any questions?
Oh, hello. May I know, sir, how much for the foundation course and take how long to learn for it? Thank you.
Can you answer that, Dr. Yao?
The cost of the foundation course is 2,980 pounds, and it will take 1 year for the foundation course. So how should we call you?
Oh, sorry, it's okay because I just thinking maybe my English not good, so we just want to know something about it. It's okay. Thank you. Thank
English is perfect. Couldn't say your English is no good. I appreciate in the future when you come into the course, the one required our theory learning will be online only. Only practical module have to be on site requirement. So when it's online, everyone will be required to open the screen. You're not supposed to hide in your face. That's also the reason why people feel online, we still feel practical. I mean, just students, of course, staff have other things to do today. Appreciate for coming, but for students, please just. So, any more questions? I find this McDonough, how to pronounce, keep coming in and out. Do you have questions?
Also again, if we pay for this 1 year fees for the foundation course, and after 1 year, I'm still study like only like 30% or 40%, understanding the course only, but we still need furthermore. Do we need to pay again, or how's it look like? Thank you.
Road, what's your name again?
Oh, sorry, my name is called Tony. I don't know the pop up the iPhone. I don't know why. Just
Oh,
Tony.
Okay, Tony. Thanks for your question. Yeah, if you are admitted to the course, you don't need to reapply. But if you said, did you say you only do 30%?
No, I mean, normally the courses or some book I reading, I really not understand what they're talking about in the book or in the paper, or we not understand what the video talking about, let's say. So the course keep running for 1 year, but after that I'm more like learning nothing because I not understand what the video saying or what the teacher saying. And after 1 year, I feel like I only learning something, pick up something 20% only. So which mean I don't learn much from the course. So what happened after 1 year? Or I continue the next foundation for free, or I have to pay again, or how's it look like?
Okay, you talk about the credit building. If you couldn't learn good enough, which means you couldn't pass the exam. The exam requirement is for postgraduate course, 2 years will be 50%. You have to get 50% of mark to enable you progress to next year. If you are not passing it, you don't get credit. You will not allow, you can have the chance to resit the exam. We were giving probably about 3 months time to revise and do a second exam. So if you passed it, you progress. Of course, you don't have to pay the fee going on to the second year. If you failed, we say you have to repeat the year, then of course you have to pay the fee to repeat and coming back to go into the course again. Of course, if you only learn 20%, you failed, you probably feel like this is not a suitable course for me. You can leave. Then of course the fees cannot be refunded. That's the thing. Because have you been in the university education?
No, I'm actually on the very, very low education level. So that's why I just only can speak very basic English, and I try to change. I'm actually is a chef, cooking chef. So it's a funny. I'm getting here really, really funny, but I just want to change my life. But as I say, I don't have any basic knowledge, so I don't know this is really suitable for me or not. So
Oh, so in that case, you will have to come in for 3 years course. Then the first year will be foundation, not called foundation. It's just 3 years. If you didn't have any education, university education before, you will have to do 3 years. So of course, our teacher will teach you, I'll guide you. Hopefully, will make you feel interested to learn the first year. So it's just more about anatomy. Of course, first of all, you have to be keen to learn. The intention to learn will teach you or will help you to learn better. If you don't even know whether this is the right course for you, you probably have to think about it and have some reading about it to see whether this is a correct career for you in the future. You don't want to waste of your money, do you? And time.
oh yeah, I get what you mean now. You're starting from some book first. Is it too difficult for me? So it's no point to waste your time and waste my time as well. Yeah. All right.
But
Okay.
our teaching, like the first year, is not just the theory, not only not only online. We will do practical. For example, anatomy. We will let you to feel the bones, feel the muscles, and identify them by hands. That's the very good learning. Some people are very good at hands-on. Some people are very good with theory, just memorizing things. So we try to combine this together to get the best maximum your learning experience. Really, it's not to be a experienced teacher, we know different students have different advantages. Of course, we will try different approach to help them. And also, if you are local, like our Dr. Yao, he's excellent. He used to be a orthopedic surgeon, orthopedic doctor. He knows anatomy very, very well. He even offer our student, one of the students who are struggling to learn anatomy, he offered this personal help to her to learn the anatomy. So we are a good team. We also have another admin person, and Yaxiong Zhang, who is just been here before. He's also very willing to teach our students. Every time when we do the teaching in the site, student observing him, he just introduce what this muscle is, what this bone is, why we needle this part. So all this will be available for you to learn.
Right. A final question is all the subject that you provided, you're teaching on English side, but I'm Chinese. So have you got like both, so Chinese and the English as well, like the book? And
You can read Chinese book yourself, but you practicing in England, you will have to learn the English, learn this medicine in English. And we hope in the future, looking at today's attendees, many of you are Chinese. If we are expanding the college, we maybe have the class just Chinese language only. Then that's possible. But at the moment, we have mixture students and not very busy, not very big number. So we were still teaching English, but you can read in Chinese. And you can communicate with us in Chinese. Most of our tutors are Chinese because they got them a lot of experience. I try to get the best teacher. So especially Chinese medicine side, you can always, for example, if you ask me a question, 你能不能告诉我这个经络是怎么走的？我不可能跟你说英文，就是中文。You understand?
right. Okay, understand now. That's all question today. Thank you. Thank you.
You're welcome. Okay. If no more questions, we will have to say thank you to everyone, including our tutors and some to-be students to come along and listening to us.